Sitcom and Broadway star Valerie Harper is talking publicly about her terminal brain cancer. Harper, you may remember, played Rhoda on The Mary Tyler Moore Show. She was just diagnosed back in January, but during an interview today on NBC's Today Show, she shared the moment she received her prognosis.
I think then when I heard incurable is a tough word, so is terminal. But he then said, but it could be a week. You could have a seizure. It could be 3 months. It could be several years. I have people with this disease that have lived much longer than the prognosis.
Well, Harper is now undergoing chemotherapy and staying very positive, telling people, I'm not dying until I do. Cindy Crane, a clinical psychotherapist, joins us. Cindy, thanks so much for being here today. You know, Valerie's story isn't unique in the fact that many people are diagnosed with terminal diseases or illnesses, but people are talking about her positive response. Is this typical?
I don't know if it's typical, but I know that it is certainly a reaction for folks who are looking for a way to kind of order their life and make meaning of it. And something that I've always known about Valerie Harper as Rhoda is that she was sort of every woman. And I think that she's reaching out in that way now to kind of reach back and give.
Oh, and I wonder, because she's lived her life so publicly on the stage in front of people all of her life, do you think maybe that's a natural part of being the person that she is?
I mean, everybody says that she's this really giving person, but there's something that I think about. You know, they say that human suffering is going to happen, but suffering alone is intolerable. And by sharing her experience, I think she's bringing that energy in as well. And maybe it is lifting her up.
And what should, you know, there are families out there who are dealing with terminal illnesses right now. What, if anything, do you think they can take away from watching her, or how they could, you know, maybe how this could positively help them with the process?
I think she is living fully in the present, in the truest therapeutic sense of that. We always talk about being present, but she really is saying, look, I'm healthy right now, or at least I'm not in pain right now, and I feel good, and I'm going to enjoy this time. And she's looking to maybe give that support out to her network. So her network should listen to what Valerie is offering to them, which is saying, let's just enjoy being with each other right now. Let's not worry about the future yet.
And how do you respond to critics who are saying she's not living in reality?
I think she is living in reality. This is her reality. We all choose our own reality. And hers is one that's apparently very pragmatic. And she is living her life to the fullest as in the life that she has right now.
And last but not least, for the folks watching at home right now who may be going through something similar, what advice do you have for them for coping?
I would encourage them to, as much as possible, reach to each other, seek therapy if necessary. There is a fantastic book called The Lonely Patient, which can be helpful. And just connect with where the patient is in the moment and give them love and receive what they're willing to accept.
Thanks so much. Great advice today. It's always great to have you on. Clinical psychotherapist Cindy Crane, thanks so much for coming in.
Thank you.